introduce our next speaker, and she is amazing. I, as a support coordinator, worked with Linda. I just sort of stumbled onto her by chance. I worked with a company called the Mental Health Nurse Collective. If you've never worked with a mental health nurse, I can tell you that the things that they can do are speechless. They have saved some of my clients' lives, literally. The work that they do is crazy. It's what they can do, what they have, the capabilities and the knowledge that they have is unsurpassed. They can do things that other people can't. They have knowledge that a lot of allied health don't even have. They have knowledge of the medical system, they have knowledge of medications, they have knowledge of things that are organic that we can't see. And so the work they do has been so pivotal for the clients that I had. And Linda works with multiple of my little kids, and the work that she's done, the advocacy work that she's done, the care training that she's done, priceless. The difference it's made in their lives, there's not enough words. For my little guys, just briefly, one little man, I won't use any personal information, but they are immigrants. They came here, they don't have English, very obscure language. They were going to Monash constantly, they weren't getting an interpreter. The tests weren't being done, they were being shuffled around to the immigrant clinic. They weren't being helped, they weren't being told what was happening. The boy needed tests, he needed so many tests, he needed help. I brought Linda in, and in just a few months, we had an MRI scheduled. We had genetic testing on the way. We had the parents understanding more about their child's disability. We had medical records that she was able to actually make sense of. She's able to advise. She's worked with the GP. The work that she has done has been invaluable for this family and for multiple other families. She is fantastic. So tonight I asked her to come here and talk about what a mental health nurse does, about herself, what they do, and a little bit too about what collaboration means from a mental health perspective for us and for the clients. So, Linda, please.
Okay, so I'm a mental health nurse, or I've been a mental health nurse for the last 32 years. I'm also a family therapist and a family therapist for the last 15, and the last 7 years I've been doing sensory motor art therapy as well. And I do a combination of the whole three along with everything else. So tonight I thought I might ask everyone, what does a mental health nurse do? Yell it out. What do you think we do? Sorry? Assessments? Yep. Assessments one? Support? Yeah, absolutely.
You help people understand who they are.
Yes, we do that too. Sometimes we find ourselves in that as well.
Yeah.
Colleagues find out who they are. Medications? Yes. Psychoeducation? Yes.
And you listen.
Yes, we have pretty good ears. We can listen.
You link your mind to all the different types of specialists in regards to medical, psychology,
We're sort of like a bit of a stopgap. We stop people from falling through those gaps, and we understand where those services are needed. We also can do assessments, quite advanced sort of assessments. While we can't actually diagnose, we can put a provisional diagnosis in and send them off to the most appropriate place to be referred onto for those assessments. That being said, so mental health nurses previously used to be known as psychiatric nurses. We help to improve the quality of life of people with mental illness overall. Nurses, I know there's a couple of nurses in here tonight, it's a team sport. Nurses never work on their own. In a hospital, you have 3 shifts. Those 3 shifts are going to read your notes, plus the consultants, plus everyone else. Who else wants to pop in and just have a look? So we always work collaboratively. We'll always have a collaboration with everyone in our team. So we also work, obviously, alongside all the other teams as well as independently out in the NDIS space. So what can a mental health nurse do? So, like what's already been said, biopsychosocial developmental assessments. These are the assessments you get when you go to Elms, we do them. And Sharon, who's a colleague here as well, also a mental health nurse, will train to do these from day one. Sorry. Okay, can you hear me now? Crisis intervention. So nurses are usually the forefront. We are the front line in any situation. When you go to a hospital, you see a nurse at triage. So we do, that's crisis intervention within the families as well. Triage the urgency too. What may seem urgent to a system may actually, okay, we can sort this out, but it could take a few days. We don't have to actually have the answers straight away. Medication support and management, of course. And we develop treatment plans for the GP and everyone else in the team. Consultant liaison is one thing that nurses do. That's part of the nursing role. Provide clinical interventions and counselling. We have actually also been trained in all that as well. Case management. And we do actually overlap with a lot of other allied health and medical disciplines. So I am sorry for OTs. We do a fair bit that you do as well. Secondary consultation with support services and education. So we have a tendency in mental health nurses, particularly community mental health nurses, do not necessarily just work in hospitals, we also work in the community, and that way we are treating people within their homes, with their environment, with their supports, and we teach and educate those supports how to support the whole system. So NDIS and mental health nursing, what do we do? Well, we've probably already covered it, but comprehensive psychosocial developmental assessments. We can do functional capacity assessments. We can also do risk assessments and interventions, monitoring health and monitoring and management of mental health. Also medication, and also if they're having side effects, we can actually get onto the GPs pretty quickly or the prescriber and sort that out. Client advocacy is a big one. Psychosocial education or psychoeducation. Physical health and lifestyles comes into it too. We don't just work on mental health, but we also work on physical health as well. And documentation, we can actually complete those documents for carers allowance. We can sign those medical reports. We can actually also sign companion cards. Taxi cards we can help. They are specifically GP, but we can actually fill it out, take it to the GP and say sign here, and they do it because it saves them time. So we do also evidence-based treatment modalities, family therapy, play therapy, art therapy, cognitive behavioural therapy, DBT, dialectical behavioural therapy, and acceptance commitment therapy, and it can go on and on and on. We've actually all got training in those. Client-focused parent work, but also, so it's child-focused parent work, it's also client relationship work we can do as well to maintain those relationships. Once again, I said frontline supports. So NDIS and family therapy, when I started this, I'm also a family therapist. So when I started this, I was like, how's it fit in? And it does fit in when it's strengthen, preserve, promote positive relationships is family therapy. Also, protect a child from harm and keeping the best interests of the child is also a nursing role as well. So there is a role for nurses and family therapists in the NDIS. So what is family therapy? So this is more talking to what I do, and Sharon's also a family therapist as well. We work within the family system. So you're wanting to know how this family works and what it's all about, how they communicate with each other, the dynamics, how they relate to each other. And in the family home, you see a very different perspective of it than what you would in a clinic. Usually they try to behave the first time, but about the third time you're in there, you're seeing those fighting, who sets who off. So when I actually see a family of lots of kids, I just play a game, basically and ask them just a simple question: who's the boss? Who's the boss? Who's the one that dogs? Who's the one that's there? Just throwing out the questions out there. They'll point the fingers, at each other, but then you have a whole history of what goes on, who sets who off, how long does it take, if the table gets flipped, I've had that happen, right, yep, that one's triggered, so it actually, and then how does the family work with those children when that's happened, like do they make it worse? So it's not necessarily setting them up to flip the table, but sometimes it does, it just happens. So it's a great opportunity also to see how they work and how to actually support them and build those, strengthen those relationships. Oh, I put the wrong one. Screen? Yeah. Nice. So it aims to preserve those and strengthen those relationships is basically what family therapy does. And we do that, as I said, in the family home. Sensory motor art therapy, I've been doing this for 7 years. This is very much a non-cognitive therapy. It's very much a touch therapy, and you're working with movement and hands. You don't have to speak in it. So for those young people, I mainly work with children who do not want to talk about what's happening for them. They don't have to. And I usually get to the bottom of it anyway. Because once they've done something and done a drawing, they actually want to tell you about it. So very non-threatening, very easy to do. I do get a lot of, look, the child loves art, okay, but they won't like art therapy. So it's very, very different to just doing art. So have got a few to go, I don't want to do this, so we end up just doing art. But some really like the art therapy side of it. So I also do clay field as well, which I haven't put a slide up on that, but that's what similar thing. Okay, clinical supervision is another thing I offer. That's just really a place and a process to go through. Anyone registered for AHPRA would know what clinical supervision is. It's a way of reflecting on your own practice. I used to be the clinical supervisor at Delmont Hospital for all the nurses there up until recently. And collaboration. This is what collaboration looks like in mental health. So the client is the partner in the whole process. They are it's a client-centered, client-focused process. It also mitigates risk, defines roles, but also and provides accountability to everyone. Yeah. Oh, done with you. And that's me. I also worked in schools for a number of years. Did you know that? I worked at Narre VIC, a specialist school for 4 years, and Carrington Secondary College for 4 years too. At Narre VIC, I was the family therapist, so helping families to stay engaged at school. At the college, secondary college I was at, I was the mental health practitioner. So, yeah. Thank you.
And I don't know if Linda mentioned it also, but Linda can help with companion cards.